Welcome to Unfiltered Physicians. This is our initial launch, first episode. I got Dr. Kim Hester with me. We'll be kind of talking about what our purpose is on this platform and what we're trying to accomplish. Dr. Hester, you want to kind of tell us what your vision is on this?
I'm Dr. Kim Hester. We envisioned this to help with all the in-betweens of what people don't know, trying to bring our profession in together as one. I'd always been thinking for the last 2 years ago, I thought I want to do a podcast, and then we were at the seminar several months ago, and we had a conversation, and then that's how it all developed, and we put this together. So I'm very happy and grateful to have Dr. Alvin on here. He is president of the Chiropractic Physicians Association of Oklahoma. And we want to just tell it uncut and raw how it is, and help others help have an understanding of what chiropractic is in Oklahoma, what we can do to help other people, how many people we're not helping. We want to go in and talk about that. And we also are going to bring in medical doctors, DOs, nurse practitioners for conversations, hard and raw conversations that will help bring the alternative healthcare profession together.
And, same thing. I've been wanting to do a podcast for a couple of years. It's a good way to bring in people that you don't normally get to conversate with and have it out in the open where our patients and other colleagues can see and come to find out that we're just not all that far apart, right? I mean, end of the day, whether you're a medical doctor, a chiropractor, nurse practitioner, or a PA, we're there to serve the public. We all take our own oaths to make sure that we're able to treat our patients accordingly and just get them better, right? That's what the whole thing is about. But I feel like we kind of go into our own corners. And for those that don't know, here in Oklahoma, chiropractors are able to do IVs and injections, and we're able to practice however we want according to our statute. But, we have this fundamental belief that you have the ability to heal from the inside without the need for prescriptions and surgeries if avoidable. But at the same time, we're realists and we understand where everyone's role is. And I think that, bringing our medical fellows over and having the conversations with them about what they see wrong with the system and what their thoughts of the profession, how our thoughts of them, and how we can kind of come together as brothers and sisters and provide the best possible outcome from our patients. That's the only way to do it, because if we're 50th in health outcomes, something's wrong. And it's time to have these conversations to kind of jump, forward and show some of the other states and our fellow citizens, hey, there is a way we can all come together. And we may not all agree on 100% of everything, but at least we have the same motivations and dogmas that we need to pursue. The one thing I will say about the chiropractic profession, we have our faults, we have our positives, but for the critique of chiropractic, when you go to church on Sundays, we have this fundamental belief, I don't care what religion you are, but we have this fundamental belief that God created us and we pray for the sick, we pray for people to heal. And this idea that we turn it off as soon as we leave church, and we're going right back to, hey, I only believe in science where prescriptions and surgeries are the only solutions. It just kind of, doesn't sit well whenever we see our patients. Clearly, we're good at what we do. We see a lot of people in our profession, and we wouldn't be growing and we wouldn't have these patients referring to us if it didn't work. And so I think that's where, on the medical side, they need to come by and really kind of talk to us and be like, hey, functional medicine, what is it? How can we incorporate that, or how can we work with you on that? And I know Dr. Hester does a lot of different stuff. You're doing IVs the same way I'm doing IVs and stuff, and you see the benefits of that. And clearly, nurses are doing it right. But why did you get into practice, Dr. Hester? Like, how did you get started?
So I started chiropractic back when I was 19. Got in a car accident, went to a chiropractor. I was going to Weber State University in Ogden, Utah. As I'd always go to school, I'd always look over to the left, and there's a big sign that says Chiropractic Health Center. So it was a really quick way for me to go see if that chiropractor could help me. So I went in there, and um, Dr. Lou Wheelwright in Ogden, Utah, cool, really good guy. And at that time, I wasn't even going to go to chiropractic school. I was looking at going to medical school or PT school. And so I knew nothing about chiropractic. Well, over my treatment, Dr. Lou said, "Hey, what are you going to college for?" I said, "I'm pre-med and going to go to med school or looking at PT school." And he said, "Have you ever thought about chiropractic?" I said, "No, I've never thought about it." And he said, "Well, you'd be a good chiropractor." So he made that suggestion to me that I would be a good chiropractor. So I just took that and ran. I'm like, man, really, this is cool. His staff was awesome. I was getting better through my car accident. So I changed my mind on the drop of a dime and went to chiropractic school. And my family thought I was crazy. They're like, chiropractic, my grandma raised me. They never took me to the chiropractor. I wish I'd have known what I knew now. I mean, I'd have been going to chiropractor because I played sports all the time, football, basketball, ran track, and didn't go to a chiropractor not one time because no one told me to. And my parents didn't take me to a chiropractor. So I'm like, dang, but that's how it all started for me. And then I went to Cleveland Chiropractic College in Kansas City, Missouri.
Very good. I mean, similar story. I mean, I don't think a lot of chiropractors just get up one day and say, "Oh, I'm going to chiropractic school."
Right.
There's something that usually happens unless you're brought up by a family member that's a chiropractor. Normally, you're not just exposed to and be like, "Oh, I'm going to do that," because I mean, there's the connotations of chiropractic, right? Like out in the public, we're all aware of that. And my parents are from India, and my mom's a nurse. Everyone's either a medical doctor or engineer, Indians. And I remember I was a freshman in college, and I got in a real bad car accident. And I just went from PT to doctor to doctor to doctor, ended up in orthopedic surgeon. I'm 19 years old. I really was pre-med, and I just didn't know. I was really frustrated with the system, and ended up meeting a chiropractor, and that's kind of my journey. I just shift focus and jumped into it, but my pain was still there. Even through chiropractic school, just kind of going through. And when we got to Oklahoma, I was told, "Hey, did you know chiropractors can do injections in Oklahoma?" And I was like, "Man, my adjustments are great, but it's just not holding. I'm hurting. I'm hurting really bad. And the orthos just want to cut. And I just don't feel comfortable with that." And I remember a pharmacist call me, and he had hurt his knee, and he showed up. He goes, "Hey, I want you to inject my knees with the solution." I said, "What is this?" He said, "It's prolotherapy." I said, "What the heck is that?" So he started talking about it, and I was like, "That doesn't make any sense." And he said, "Well, do me a favor. Go see this guy. Get treated. Treat me. And then if it helps you, I think you should do this." And I remember going to Arizona, and I paid for this guy to teach me. And he said, "Man, this is a great class. You can do this." And about 6 months later, my pain was better. And I thought it was fantastic. So I learned it. We incorporate it. I never realized how many people were frustrated with the system, right? I mean, I went on a radio show and I talked about we have 10 to 12% of the population that sees, a doctor that really needs like cardiac surgery. If I get shot on the street, I'm praying to God the best trauma surgeon is at the office and I want to get treated. My family doctors are great, but they're stymied by insurance and time. And a lot of us, we see 6 to 8% of the population. Those are the people that really believe in natural medicine stuff. And for the longest time, I just started figuring out that there's this gray area where everybody's just frustrated with the system. I'm sick, no one's listening. I'm hurting, no one's listening. And no one's able to go down the rabbit hole and play detective work and figure out, what can I do to get better without staying on these meds? I don't care if it's high cholesterol and whatnot. And that's where the journey of just going back and getting more seminars and trainings and things like that. And you're probably like me, you probably meet a lot of medical colleagues and stuff like, "Man, I didn't know you were able to do that." And I think that's the conversation. And we are blessed as a profession, I think, that all of us have different backgrounds and we all got started for a certain reason. My best friend is in Louisiana, and he does not practice the same way as I practice. To this day, I mean, we went to school together, right? We adjust differently. We treat each other differently. I'm really good at adjusting, but he's really good at it, but it's totally different. I can start an IV like that, and my medical staff comes in and they're like, oh, I don't know how to do that, so we're all blessed with our own gifts and stuff. And I think that's where our strengths come in. And instead of looking at it as a weakness, which is what's going on in our state with politics, is right. You got one association, one group saying, well, in the 1890s, this guy adjusted somebody, and we think that that's the cure-all for all of it. And that goes back to our beliefs in Christ and being able to pray for somebody. And I get that philosophy. But in Oklahoma, if we're allowed to do certain things and your patients are getting better, PRP is a prime example. 10, 12 years ago, when we were all talking about PRP and doing it in our office, medical doctors were like, that's just the most phooey, quacky thing you could ever do, right? We're always 10, 12 years ahead, and there's no science on it. It's this and this. And you look now, and I know a lot of orthos and DOs that are doing platelet-rich plasma. You look at PRP now, and they're like, okay, there's other stuff you can do now, and then you got one association saying, well, you know what? Now you're just trying to be a medical doctor.
That's sad.
Right, and that's sad. And we're in a state that we're blessed to be able to have our individual rights. We shouldn't have, you shouldn't be able to get stymied on something that you're trained to do that's in your scope. You may not like it, but that is still your opinion. And when you start affecting people's families, whether it's your patients or these physicians and their families and stuff, I think you go down the rabbit hole. And not only do you make healthcare worse, but your patients that you took an oath for, you're doing just as much damage by not giving them access to that type of stuff. And that's what the whole national healthcare debate is with insurance and drugs and all the other stuff, right? What's fair, what is a time and place to do something, and what isn't. And I think this podcast, that's the main reason I wanted to start it, is having the discussions and getting critiqued on our end, right?
So, Doc, let me ask you this real quick.
Yeah.
Wasn't split my tongue. What year were chiropractors able to do injectables in the state of Oklahoma?
1991.
1991. Okay.
Yeah. And the story is that there was a faction of 3 or 4 associations.
Mm-hmm.
And at the time, the DOs and MDs didn't want to do those type of things. And so chelation therapy, vitamin IVs and stuff have been going on since the 1920s here in Oklahoma. Most people don't know that in rural Oklahoma, most people saw natural doctors for their care. There's no providers out in the rural areas, and that's how they survived. I mean, we don't do it now, but back then, I mean, they were delivering babies and signing death certificates and things like that. People don't realize that we're able to do that here in Oklahoma. And when they passed that law, it just kind of took off. And a lot of us, I mean, most of us don't really advertise like that, right? I mean, it's all referral. And as time went along, it just started growing. We dropped the ball, though. I think that as a profession, as an association, we dropped the ball. And you tell me if I'm right on this or not. You can critique me now. But my argument with chiropractic is, and this is unfiltered, I think we do a poor job with these schools. When you go through these schools, you come out with $200,000 in debt. And they feed you this image of what you're going to do. And you get out there and there's no guidance. And then we're told to join these management groups who charge thousands of dollars a year. And we don't have insurance access like we used to, right? We let that go. And the management groups and the schools control the narrative, right? We have great didactic. People don't realize our training, our education is fantastic. Our ability to diagnose is fantastic. But our clinical experience outside of the manipulation is where we kind of lag behind, right? We're not able to look at, hey, this doesn't work. What's the next step? We just know this. Whereas I think medical doctors is backwards. They've got good didactic. They've got great clinical knowledge, right? Like I said, if I'm shocked, I'm going to that surgeon because I know he knows how to fix me, right? I'm praying that he does that. But the ability to deduce and go down and go to expanded lab panels, right? Like functional medicine. Why do we look at functional medicine? And deduce things and look at other things like some of what the Europeans are doing. That's where they lack. And so they've got their strengths, their weaknesses. My philosophy for chiropractic is, man, if you go get your certifications, I don't care what you do, even if you're just doing adjustments, take away insurance. We're not talking about, we're the only profession that talks about how many people we treat in a day, how much money is collected. Nobody does that. No profession does that except ours.
True.
Right. And
Yeah.
I think if you are a dentist, if you're a medical provider, you're a chiropractor, you open up, you keep your overhead low, you treat people and keep it efficient, you give them a great price on it. Don't screw the system. Just treat people. You will get referrals. I mean, I've got a nurse, right, that's referring to me all the time. I refer to her all the time. I refer to chiropractors all the time because I know they're good at what they do. And I think that's the general premise of where I think we're stabbing ourselves in the back and we're losing rights. We're losing rights with insurance as far as rehab. We got these huge audits and the stigma about what we're doing. And I think if we don't come to the new age and we're adapting like the PAs and the NPs now who just got prescription rights, I don't think we're not looking for prescription rights by any means. I don't think we need that. But I do believe that we work with those people and come together. And I think that's how Oklahoma's going to get healthy.
Yeah. What we're able to do with our injectables certification is we're able to do injections that are minerals, vitamin IVs, utilize ozone. Those are all alternative healthcare measures that really are effective for people. I'm big on ozone, huge on ozone because it works. It's been around for 100 years.
The biggest nutrient on the planet.
Yeah, and the whole thing on that is that ozone, the FDA basically said it was a harmful substance, toxic substance 30 years ago, and they left it at that. And they never went back to it to even address it, that, the benefits of it. But there's medical doctors across the country that use ozone. Over in Europe, that's all they use is
That's
ozone.
right.
They use ozone. So it's crazy that we don't, utilize it. And what's frustrating is that I think every chiropractor has the right to practice the way they want. We went to school, we got out of school. When we graduated, things are just not like they were in school. We don't practice like what they taught us in chiropractic school. We really don't. You just shoot yourself in the foot. And I, bless these kids that are going to chiropractic school now.
Yeah.
I don't know, man. I don't know how they. I'm not going to say this like how they're going to make it, but
it's a lot tougher.
It's tough, man, because there's no when I graduated from chiropractic school it was '98, and insurance was pretty much prevalent across the country. Everybody was billing insurance, but now, from what I hear, there's only like a handful of states that even have insurance benefits. Oklahoma's one of them, but they're getting worse constantly. I'm only a provider for like 5 different insurance companies.
Well, that's the problem is we've been in it long enough to know that the guys in the 80s and 90s, whether you're a medical doctor, dentist, or chiropractor, insurance was king, right?
Yeah.
Insurance just isn't an answer. And you're blessed like I am, where we have people coming in from out of state for treatments and things like that, where they search for answers that are affordable. If you do that, insurance doesn't matter at that stage. But a lot of these guys that are quoting, I'm saying 150, 180, God bless you for doing that. I'm not saying that that's bad. But I need you to get off insurance and treat those patients and make it worthwhile instead of, me and you have been in management groups for years, and we kind of see the crap on the back end, right? It's let me do something for $10, let me do something for $15 and run up my numbers and then brag about how my numbers are. And you ask some of these guys, I mean, we know these guys, we hang out with them, and their wrists are bad.
It's funny. It's funny you say that, because like when I used to practice in Utah, I was like one of the top guys and that was seeing patients in my management group. I was seeing like 500 patients a week, man, 500 patients a week, working my butt off, and the way it was designed is, and the compassion of what chiropractors have, and the compassion of what I have, I was just treating patients like, just treat them, and I was taught that to treat, whether they could pay or not, if their insurance didn't pay for it, then I was treating them. And in the state of Utah, there's so many families, so, a lot of the people there that I was treating were like stay-home moms. The dad was working, they had 4 or 5 kids, 2 or 3 kids. So they had a lot of families, so they didn't have the money,
Sure. Yeah.
And, so, I would just treat them, and it was the thing that I was like, oh man, I thought I was like, oh, this is so cool. I saw 500 this week. And hell, I mean, I saw like 500 2 weeks in a row by myself with no assistant. No one's ever done that before.
Right.
You know what I'm saying? That I know of. But I was a machine, man. So I know how that works. And it's a lot of, and the crazy part about it, I think I collected like $50,000 a month.
Yeah.
That was it, man. And if you do the numbers, like if you're seeing 500 people, you should be collecting over 100 grand or more.
Well, that's the thing, is they value it accordingly, right? But I mean, a traditional MD that's tied to an insurance can only see so many people, and you're tied to that corporate structure as well. We own our own businesses. We're able to do certain things. But I mean, this is where, I think the guys that go for these advanced trainings, where we're going to these universities and classes and stuff, and you're learning a lot of different things, you can have a space where, look, if all you want to do is adjust, man, God bless you, let's do it. I mean, those people are better off doing that, and they're better, right? I mean, there's a reason why shoulders and ribs and, migraines and stuff are helpful. I mean, there's pediatrics, and I know other professionals like, oh, this guy says he's a chiropractic neurologist, oh, that guy treats babies and stuff. Well, I mean, you haven't looked at the science on it, and I get it. But when your kid is crying for 5 days straight, and you go into the ER and they're talking about doing surgeries and they're talking about doing all this other stuff, and you go to a chiropractor and it worked, instead of questioning it, call them and ask, hey, what the hell did you just do? Because I've been trying to figure this out for 5 days. And they don't do that because of their egos, right? We do the same thing to a degree too. And, our own profession, we stab ourselves in the foot quite a bit. I mean, we're like crabs. As soon as one tries to get out of the box, you pull them right back down. And, we got guys that go on videos saying that, oh, Philipose doesn't believe in chiropractic. He's a medical doctor. He should have went to med school. I got guys emailing me threats and all sorts of crap,
Listen, man, you're totally, you can practice the way you want. That is the benefit of being a chiropractor, or the freedom you have. There's chiropractors that come out and they want to go into rehab. They do rehab. They do more of that. There's chiropractors that just adjust patients. They don't even have traction tables. And if they did, they're getting rid of them. They're just adjusting patients, and good for them. That's what they want to do. Great. Whatever shoots you in the foot, you know what I'm saying? Whatever works best for you. But there's doctors that do like muscle stim and ultrasound. That's what they want to do. There's doctors that do acupuncture. But what's the difference? If you do acupuncture, I mean, are you trying to be an acupuncturist? I mean, you know what I'm saying? It makes no sense. Like, I did a fellowship with Dr. Yini up in Kansas City. So the fellow Acupuncture Society of America, bless his heart, the late, Dr. Yini. And so we were doing acupuncture, but acupuncture is not chiropractic. You know what I'm saying? It's a modality of that, and what we were using it for. And every state, as a chiropractor, whatever that state board presents, they say, oh, you have to have 100 hours and pass the test. Or some state says you have to have 200 hours and pass the test. And then now you pretty much have to have a Oriental medical degree to practice acupuncture in any state. You know what I mean?
Well, I
It's
mean,
crazy.
acupuncture, I mean, we got chiros that advertise acupuncture, but they'll do auricular therapy with E-stim. But then
Yeah,
they get mad if you use needles. I'm like, what the hell is wrong with you? Like,
it's insane. Yeah, it is. I mean, acupuncture is over 4,000 year,
yeah,
principles and whatnot. There's so many different ways to do acupuncture. They just never changed the literature on it. Acupuncture is, you can take your little teishin, a little hydraulic pin, and stimulate the points. You can use a moxicone on there. You can use a tack needle in the ear.
yeah,
You can use electric acupuncture. You can use laser acupuncture. I use all
yeah,
those modalities.
yeah.
I just use all I do, whatever it takes to get the patient better. Sometimes I'll put the tack things in their ears. And one reason why I stopped doing, I'll just tell you, uncut and unraw. One reason why I stopped doing a lot of the needling when I was practicing in Utah is it took too long, man.
It's
It
too
took
long.
way too long, and
Yeah.
the needles fall out, and it's 20 minutes, and it's like, some of the protocols had your 40 needles you're putting in a person, and it's like, it's like, man, and the needles fall out. And then on top of that, everybody wants insurance to pay for everything. And
Right.
if insurance doesn't pay for it, then, okay, so how in the heck can I sit there and have a patient come in here when they have a hard time struggling to pay their copay? And then all of a sudden, acupuncture's there, but the insurance doesn't pay for it, but they want acupuncture. But acupuncture is like, for time, it's like a $40, $50 charge on top of their copay.
Right.
And that's like a $100 visit. So I had to quit doing it because people couldn't even pay for the chiropractor, let alone pay for the acupuncture. So it's like, man, I had to quit doing it, man, because I wasn't getting paid for it. So I had to think of a faster way to do it that was even more effective. So we started doing auricular acupuncture and putting the tack, needles in their ear.
But I got patients, I got doctors, I got a medical doctor actually. He got frustrated with the system. He's like, man, I'm just not getting any better. Right.
Yeah.
So he traveled to China and I just want to see what they're actually doing. And he's got this great practice in Maryland that's amazing. And he takes his time with every patient and it's just him by himself. And it's great, And I think that's going to be more of a personal calling if you want to go. I mean, we're seeing more people doing functional medicine than when we were doing 20 years ago, right? If it didn't work, people wouldn't be jumping into it. And I think there's pros and cons with that too. But, this idea, our physicians, especially, someone put out a video saying that chiropractors cause stroke. No, I didn't say that.
Man, I'm so tired of hearing that.
It's so stupid.
That's
I never said
craziest
it.
thing ever.
That wasn't the context. Someone had brought in this argument against B12 injections or something. And I said, we're all physicians and we do the best we can to make sure our patients are safe and we do our protocols. And if you're not doing the exams, you're not doing the x-rays, the third leading cause of death is medical error. So take that.
Yeah.
Let me
Third
put
leading
it
cause of death.
right? So, I our own profession saying that, well, these guys are going rogue and they're not adjusting. They're saying we cause strokes and stuff. No, we didn't. You're lying. You're just a liar. It doesn't.
You know what I say to patients when they say that? And it's sad, man. Well, it's tough for a chiropractor, man. It really is. And we're the only people that understand ourselves. No one understands us but another chiropractor. It's just a lot of it,
Yeah.
27 years, man. I've been out of school since 27 years. I'm still trying to explain to people basic principles of chiropractic. Do you know that only like 10 to 15% of the population go to the chiropractor?
Yeah,
it's insane, man. It's insane.
We suck at educating. We suck at standing our ground and holding our statutes and our profession and raising the bar every single time. And that's where I said that if we accept everybody, that's the problem, right? I mean, you go to these seminars and you look and you go to their offices and stuff, man, you got to present yourselves as physicians and hold your ground. And I don't take crap from anyone that knows me knows. You walk into my office, my staff, everybody knows. I mean, my PA loves what we do. He didn't understand it and he loves it. He comes in, he watches and he's like, man, I'm doing this now. And this is how yes, that's how you do the injections and stuff. Like he's asking me my advice. I'm asking him his advice. My medical doctor's fantastic. He got frustrated with the system. He comes in and he's going down the rabbit hole because, man, I just learned this. Yes, doc, that's what we were talking about. And then I had a question about something. I'm able to conversate with him. My nurse, my RN comes in and she's like, man, I never realized how this helped people. And I think that communication is there, but when our own brothers and sisters are saying, oh, they don't want you guys doing that. Well, where are these patients going to go? For natural medicine, we're it.
Yeah,
We're
man,
the directors.
that's the thing. That's why, like, okay, so when I started practicing in Oklahoma in 2015. So I had no clue that chiropractors in Oklahoma can even do injectable,
Yeah.
injections and stuff like that. What? I said, really? And so at that time I was covering for a doctor who was sick. And so I didn't know how long that was going to be, but I thought I was going to be in Tulsa. So that's where I was going to practice. So I was trying to start a practice in Tulsa, but I was working for a guy down here that had encephalitis of the brain. Go figure on that, And they never could have figured out what was going on. How he used to go, from what I understand, he used to go travel all the time. He would travel all over in Europe and, South America, and he caught something and they didn't know how to fix it. And so the 90 days turned into like 6 months, a year. I'm driving back and forth from Tulsa, Oklahoma City. And, and his patients were receiving injections from him. And they were wanting me, like, can you do the injection? Like, I'm not sort of trained to do that. And so that's how one of the biggest ways I got into it, because I was like, man, like, okay, I guess I'm always trying to make the patient, And so I'm like, oh, I got to make these patients happy. So I got to, I can't be the doctor that doesn't know how to do this stuff. So I got to go take the course and do it. So that's how I got into it. And boy, am I glad that I did, because that was like one of the biggest things, that to have that tool in your pocket, it doesn't make sense, not to, other doctors around the country want what we have, but they don't have. Look at the doctor in Utah. We'll talk about that. They can do PRP, but in the state of Oklahoma, they said it's not warranted.
Our own brothers and sisters did it. They came out and said, we were doing PRP, we were trained in it, we were taught it.
Yeah.
And this idea that, hey, by the way, it's a FDA scheduled drug and there's no nutrients in blood and patients lose rights to their blood when it gets drawn out. Like, what the hell are you talking about?
Man, this is just the most ass backward thing ever, because those chiropractors in Utah, all they can do, well, they used to do, well, I'm not sure how it was now, but they could do the homeopathic.
Right.
But homeopathic used to not be RX, but then they changed it RX, and then their laws that had RX, but I think they fixed it. At least they fixed theirs. They're able to do it now.
We're over here trying to repeal scope,
So,
and then to make it 10 times worse, we've got one association put the board members on our Oklahoma State board, and then we find out there's emails trying to stymie us and trying to prevent quorum. And then we have to go to legislators, and we look stupid in front of legislators because there's this infighting going on, when we should be focusing on workers' comp reform because we can save them money, or trying to get Medicare reform and showing how Dr. Hickman's got a great practice where he does rehab at his office, and he's got a great setup. Let me show you how the state can save some money on healthcare if we do X, Y, Z. But instead, we're over here doing conspiracies and stuff that'll get your ass in jail for no stupid reason. It's dumb. And then you're making these racist-ass comments, coming. You can do that all day. Listen, I grew up I got a pretty eclectic group of friends, and we're all professionals. But at some point, I'm telling you, that's not going to be in your benefit. That's you're defeating the purpose of why you got into practice. And you can go do lectures and preach it all day. I don't have a problem with that. If that's your business and people want to pay for you to go do that, and you want to do that, that's great. But the rest of us, I have a great practice that I've built over 25 years. I've got great staff. I've got people coming in from all over the place. And my job, my dedication is what I prayed for. My own friends don't like it. I don't treat any friends or family now.
Man, it's hard to treat friends and family because it's it is. It's because they don't want to listen, man. They don't want to listen to nothing you say, and then come back to you like, well, such and so said this. Like, well, shit, I said that freaking 10 years ago. I said that 2 years ago. Every time I speak, I'm saying that, but now you heard this other person say it. Now it's something new. Really?
But then I
It's
get a
frust-
referral
it's
from Canada, right? Like, hey, man,
well,
I
well,
heard you're doing this. Can I fly down, stay the week with you? Absolutely. Come stay down. Okay, come stay the week with me, you know?
well, it's frustrating because you're only trying to help people, and by all means, you want to help the people that you love, your family. You want to
Right.
give them advice. You want to help them. You don't want them to have a common cold, and you want to, hey, chime in. Hey, come get an adjustment. Let's help stimulate your immune system. Let's get an IV. You know,
Yeah.
like listen. So this week I had the flu, man. I had the flu. I don't get sick very much, man, but I'm human.
That's all
So
you get in your IV.
yeah, man. So I was like, I caught it, man. And so, but you know what I did? I jumped right on it. Man. What I did is I got adjusted. Just standard with me, standard. So I got adjusted. Then I did the IV. Now, out of desperation, because I didn't have a right hand, I did it myself, man. So I did the immunity IV.
Yeah.
Man, I felt so much better from doing the immunity because, with the lungs, and you want to build that immune system up, them immune system and modulators, and T cells and all that. So I felt so much better. My energy came up, and then I didn't get any. It didn't go any further. I stayed home. Like I was home all. New Year's Eve, I was home, man, just chilling, watching the Dick Clark show. Or well, it's not Dick Clark, the Ryan Seacrest, But
Seeing
that's
you
what
guys.
that's what I did, man. And so I stayed at home. I stayed at home. I was tired, fatigued, but I kept doing those IVs, man, and it brought me back.
I mean, you got nurses doing it now. You got medical clinics doing it now because
Yeah,
it works. But we were,
yeah,
what, 40 years ahead
yeah,
when we were doing those
yeah.
things. And I
And
was
check
like,
this out.
I'm doing this new thing called a vitamin C IV. What?
And then also, so we always do the innovative stuff because listen, I know about the ozone stuff. I'm so excited about the ozone. So I took the nasal cannula, man, and put it on, and I got the ozonobaric P, and so you can calculate it and do all the calculations. And so you put in the bubbler, you have like a little bubbler with olive oils. I put peppermint and eucalyptus in there. And I watched, learned how to do this. So then I bubble the ozone in there, and it turns it from terpenes to ozonites to terpenes. And that way we can breathe it in our lungs. So I'm wearing a nasal cannula for like about 30 minutes, just getting the benefits of the ozone in my lungs. Now, when you're sick with the flu, the lungs one of the first things. So if I'm killing the viruses and the bacteria that are in the lungs, I'm winning. And
Sure.
so these are some of the things that help people, but we've got to just continue to educate.
Right.
That's better than doing other things that they're doing out there. It's
And
all
they're wanting to
natural.
do it, right? They're wanting to do this too. They just don't, and I get it. Like, when you introduce something new, if we see that it's helping people, we just offer it, right? By the time you wait on peer reviews and all this other stuff, and then guess what? This drug gets pulled because there's this side effect and all that. You know, that's a discussion the medical group will have amongst themselves, right? But as far as our profession, I think bringing on that's the whole purpose of this. Like I said, this podcast is to bring in our members, even if we don't agree with them, other chiropractors, other trainings, and bringing in PTs and nurse practitioners and legislators. I think legislators don't understand our laws and what we were able to do until we started really kind of educating and say, hey, I don't know what you heard before, but here's what we've been able to do, right? Don't listen to the bullshit. Here's the stuff that's really going on. And you show it to them. I mean, I just talked to the legislator a couple of weeks ago. He's hurting really bad. He goes, man, I know you're doing this stuff. I've tried everything. This is what's happening with me. I said, man, you just got to trust me. Let me show you the science on it. You explain the science. Here's how the process works. Here's what I'm going to do. And you walk him through it. 2 treatments later, better, out the door. And he's like, this is probably the best thing I've ever done.
That's great, man.
And that opened his eyes to where, now he's texting me. He's like, man, what do you need help with? Like, how can we get this word out to the public? And I said, man, you just got to talk. You guys have to talk, and you cannot take us back. And we want to go forward. We want more training. We want these schools to adapt. And I think as a physician, you get to choose how you want to practice. That's the beauty of America, right?
Right.
I can worship, I can practice, I can live, I can open up. This state has allowed me to open multiple businesses over the years. Once you restrict one right, I don't care what that right is. I'm a sincere believer that once you restrict something,
they're coming for more.
keep going.
Yeah.
Our state board brought up applied kinesiology for some reason. I'm like, look, I don't do applied kinesiology. Not something. It's not on my radar. I don't understand it. I don't believe it. But I've got some great doctors that do it, and they get results, right? And we're also one of the professions where I believe 50%, if not majority of it. You ever had those patients that walk in, man, my back was hurting, but I walked into your office, it's not hurting right now.
That energy, man.
That energy, right? I mean, and that's medical doctors too. I think MDs have that. I think you go into somewhere and you can feel that aura, that presence, right? And that's where there's science now talking about frequencies and auras. And that's how you ever talk to someone that's just really successful and you're in the room with them, man, the energy that person brings, right? Like you can just tell, man, that's a good dude. And you look at his life and he's got this going for him, this going for him, this going. It just comes naturally because it's that aura.
It's the aura and it's the energy, man. It's like you ever seen a dog come around somebody and the dog just keep messing with that person?
Yeah.
I mean, it's like they can sense the energy, man. A bad person, you know what I'm saying? And so that's key, So
and it's the other way around too.
Yeah,
right?
Yeah.
I mean, you meet someone negative or just angry or just bitter, and like, man, you ever get? I get like this, and I was talking to my pastor about it, and I said, man, you ever feel this ick after someone leaves? He goes, man, there's reason for that.
Suck
right?
all the energy out of you.
Yeah, it just sucks the energy right out of the room. And I'm breaking out the holy salt and the holy water, like everything in between,
Man, you got to put that bubble.
Yeah.
That bubble around you so that you know how to do it, but I'm just saying I have to do that. Like I put this bubble around me so negative energy doesn't affect me or like, because we're in patients' faces all day. And that's what I'm saying. Like I don't ever get sick. So like I'm breathing all of it, but we're constantly doing things to keep our immune system. See, our body's constantly trying to fight off foreign invaders and all that stuff all day. Viruses and bacteria, it's constantly doing that. And if you're healthy, it's fighting it. But when you let stress become a part of you, the negative stresses, then that allows your body to have a lower resistance to get you out of balance and make you susceptible to the virus and the bacteria and getting sick and all that stuff.
Yeah.
So, yeah.
I think that's what the podcast, the unfiltered part is having these raw communications with people. And we're going to be having guests on this show. And I want to know, hey, why did you get started in medical school? And
I'm excited, man.
Practice, right? Hey, I'm a nurse practitioner that's doing functional medicine. I'm going to reach out to her. Hey, why did you, you're a nurse practitioner, right? You went through the science, you're doing the prescriptions, you're doing all this stuff. What made you prompt to get into functional medicine? And I want to know that. I want to know the PAs. And we talk about psychologists, right? And talking to psychologists about, okay, well, we believe in the three things that throw us off kilter, right? Which I believe four is one's emotional, physical, and chemical.
Yeah.
And the fourth is spiritual. But emotionally, if somebody how does emotions target someone's physical essence or their chemical essence, and how can we talk about mental health, and how can we?
Oh yeah.
I think that's.
And I'll talk about all that because I'm in the world of metaphysical. So the metaphysical part is the physical body. The emotions, like concepts that people have that concentrate upon, they start to manifest in the life and body, and so that's a big thing with a lot of people. But it's just like, man, it's like we're trying to help people heal and help people get on a better path of health. That's all we're trying to do.
Yeah.
That's all we're trying to do. And that's what's so frustrating is that we don't, it's like chiropractors get enough badging all damn day as it is, man.
Yeah, why do it to ourselves?
People come into my office like it's so pissed off, man. Hey, such and so said that this one lady, I don't know what she said. She said like someone said that by getting an adjustment it caused a stroke, and she's scared of her neck to get adjustment. Like, are you serious? I said, listen. I said, I don't know nothing about that. I haven't heard anything about that. I said, but I think if that'd have been national news, breaking news, CNN, Fox, whatever. Chiropractor hurt somebody. Because that's how much it seems like what people are against chiropractors, against us, what we do. 27 years, that's how it's felt for the most part. Because it's the thing, 10 to 15% go to the chiropractor. Patients still coming in saying we're hurting people. And I tell this to patients all the time. I say, listen, chiropractors aren't hurt nobody. I said, guess how much malpractice insurance I pay per year? And they're like, I don't know. I said, about $1,600. I'm like, what? I go, $1,600 maximum coverage. Right. So that tells you we're not hurting nobody, because if across the country people were killing people, by adjustments, and so many people are getting strokes and this and from adjustments, they would say, damn, we got to raise the standard. So the standard base for chiropractors got to be, you guys got to pay $20,000 a year because we're scared you're going to do this and this and that. So it's a bunch of lies, man. It just is.
We get people that come in with these botched fusions and they're in pain management. And I had a guy, man, bless his heart. There was nothing we could do for him. He was miserably hurting, and there wasn't a patient we can do, but that medical route he went to was not the answer. Right. And I'm not, stuff happens.
Right.
I don't care who the doctor is. Pretty rare you see somebody intentionally trying to hurt someone. I don't care what profession you're in. No one intentionally tries.
And it protects you so much when a patient comes in and you do you do an exam. You just don't throw people on the table and start adjusting and doing stuff. You have a conversation with them and do a health history, just like any doctor. We're primary care physicians in Oklahoma. Is that correct? Last time I checked. So,
you have techniques that you may not have to do something physical, right? Like there's simpler ways. A 90-year-old lady coming in, you treat her a little bit different than someone that's 18 or 25.
Yeah, you're not gonna do a baby posture and jump on this lady's hip. You know what I mean? You gotta just know common sense, man.
Pediatric guys like, hey, you guys just crank on baby. It's like, what the hell are you talking about? Like, no one's doing that. Just shut up.
Yeah.
I think we get along. I get along better with a lot of my medical colleagues because I just went to lunch with he's just a good friend now. And just being able to say, hey, here's what I believe in. Here's my critique of my profession. Here's what I think my profession needs to do to get better. Here's where we're moving forward. But here's what we're good at. And then he's able to open up and say the same thing. And I think that's what we need to look at. And, I know we're going to wrap up this show here, and we'll be putting together our schedules of who all's coming on. And if you guys listening have people that want to come on, and have these discussions too, and if there's certain topics you want to talk about, throw it out there, because that's what we're doing. And we're ready to throw it out there unfiltered, right?
Unfiltered. I love it. Unfiltered
All right.
is like the best way.
All right, let's do it for the next show.